Hi everyone, it's the Ocular melanoma MDT from Southampton. I think you know everyone, don't you? You know Matthew? You know Sachin? We're here really just to have a chat about where we're at. There have been some changes in the guidance on the use of different treatments for ocular melanoma. So we thought as a group we'd just chat about where we're at and what implication that has for patients. So Matthew, what's changed in the last few months from your perspective?
So I think the updated NICE guidance highlights our feeling as a group that PHP certainly has activity in metastatic ocular melanoma, and in our experience has been a safe treatment to deliver. And with the simultaneous early release of some of the provisional results from the FOCUS trial, I think that supports that feeling. So we've seen an increase in response rates compared to best alternative care, and the duration of control of liver metastasis seems improved in these early results. Clearly the next step is to see the impact of that on survival. We need to know that these responses are translating into patients living longer with their disease.
So say that again. So the data from my understanding shows that, certainly the early FOCUS study data shows that if you have the treatment changes how long it takes your tumours in the liver to grow. What you're saying is that might not translate to living longer.
Yeah, so we need the data to confirm that, and yeah, absolutely. Our hope and expectation would be that it would translate into patients living longer, but we need the certainty of the trial data to show that.
And when do you think, any idea when the FOCUS study data will come out fully? I know everyone keeps on saying it's next month. It seems like it's been there for a long time.
Yeah, so I think we're hoping that there may be a bit more detail in June, but I think in terms of the survival data, it'll probably be later this year at the earliest before we see that.
And the NICE have changed the level of evidence or level of safety, I suppose they see it, from a research-only procedure to a procedure which can be used in more routine practice, provided we keep patient data, we keep databases, we make sure patients are consented. Will that make a difference on whether or not everyone gets access to the treatment, do you think?
Unfortunately not at this stage, so no, at the moment the guidance that NICE have issued is purely around safety and this being a reasonable treatment for patients. What we haven't yet seen, and what clearly is critical, is a funding stream for this treatment, and I suspect that that the survival data is going to be critical to achieving that, but obviously we'll be keen to hear from the funding organisations as to how much data that they might need to consider approving this.
So that's useful. So that's a sort of mixed message. So we're saying that the NICE changing the what they see as its role is good news. It's showing that they're confident that the safety is getting better and they're confident this is having some effect. But to get commission service, to get the NHS to pay for the service, we're going to need to prove that actually patients are living longer, and there's that awful thing about value for money in the NHS. And you think that won't come until we've got the FOCUS study data, which will come out probably at the end of the year?
Yeah, I think that randomised data is really going to be critical to confirming the efficacy of this treatment and then getting an established funding stream for it.
Yeah. So it's sort of mixed news really. It's good news, but it's also, we still feel like we're stuck in that limbo, don't we? And I'm sure patients do too.
Yeah, no, absolutely.
Good, thank you.